Pathology is a beautiful subject, and I thank you all for coming and eagerly waiting to hear about pathology. And how do you define pathology? It's done by our great grandfather Thiruvalluvar, who told நோய் நாடி நோய் முதல் நாடி அது தணிக்கும் வாய் நாடி வாய்ப்பச் செயல். It's Tirukkural 948. What is the meaning in Tamil? ஒரு நோய் இருக்கிறப்ப அது என்ன நோய், அது எதனால வந்தது, அதை எப்படி நம்ம தணிக்கலாம்னா ட்ரீட் பண்ணலாம் அப்படின்னு ஆராய்ஞ்சு அதுக்கு தகுந்த மாதிரி நம்ம ஆக்ட் பண்ணணும் அப்படின்றது தான் குறள். வள்ளுவர் எவ்வளோ தெளிவாக சொல்லியிருக்கார் பாருங்க. நோய் நாடி, நோய் என்ன, நோய் முதல் நாடி, நோய் எதனால வருது, அது தணிக்கும் வாய் நாடி, அந்த நோயை குறைக்கிறதுக்கு என்ன செய்யணும், வாய்ப்பச் செயல், அதை செய் அப்படின்றது தான். For those people who don't understand Tamil, whenever there is a disease, test the disease, find out what is the cause of the disease, and find out how to cure the disease, and then apply the remedy so that we will have a disease-free world. This is the definition, beautiful definition of pathology. And you all will be surprised. 70% of the medical decisions are based on pathological findings. So pathology plays a very vital role now in medical decisions. And to celebrate and to honor the pathology and pathologists, they make second Wednesday of every November as International Pathology Day, and this is started by Royal College of Pathologists, who also made the tagline of I love pathology. And since it's 8th November 2023, you can check with the calendar. It is the second Wednesday of November. That's why we are celebrating International Pathology Day today. And I thank the organizers for giving me a chance to share my thoughts on pathology to you all. And I want this very to be informal. So if you have any questions, you can get the mic from Benita, and Benita can tell me, and the student organizers can also help volunteer in giving the mic for the people who are having the questions. We will see the question, we will clarify things, and then we will proceed. And I assure you, I won't take more than 30-35 minutes. So in pathology, many people think we always say bad news, and all the bad news start with I hate to tell you, but we give good news also in many times. So we are going to see 5 scenarios where clinically and radiologically they suspected bad news, but pathologically we delivered good news. Case number 1 is a 21-year-old female with proximal femoral lesion. You can see the MRI here, and you can see the femoral head. It is totally destroyed. And you can see even the breach in the cortex of the bone, femoral bone. So radiologically, they thought it is malignant. They thought it is chondrosarcoma or osteosarcoma. And they took a biopsy and sent it to pathology. In the pathology, we saw this material. These are foreign body giant cells. You might have seen the giant cells in TB. In TB, it will be horseshoe shaped, whereas here it is totally circumferential. Another giant cell here, another giant cell here, 4th one, 5th one. So there are multiple giant cells. And here you can see the bone fragments, and see the bone fragments irregular. So this is a dead bone. And you see some film-like material, which is brownish in color. And in some areas, you can see pink color with laminated appearance. This is very characteristic of a particular disease. All of you might have already thought something in your mind. And when you go through the slide further, you see some skeletal muscle bundles and this diagnostic picture, which is a daughter cyst of the hydatid cyst. So the diagnosis here is hydatid cyst on the left femur. So they thought sarcoma, and the treatment for sarcoma, you all know, limb sparing surgery followed by chemotherapy, whereas hydatid disease, they can treat it with medicine. It's in fact a very wonderful news. And you all know hydatid disease comes in people who are having dogs. And I think Benita was there at that time at Ramachandra. And she got the history. The girl is from a family of farmers and they have dogs and sheep with them. And that's how she got the disease. And I came to know you may be having hydatid disease of the liver as one of the specimens, and they may ask you in the exam. This is the liver. And the cyst looks like a tender coconut. நம்ம தமிழில் வந்து அந்த இளநீ சொல்லுவோம் இல்லையா, அந்த தேங்காயோட இது இல்லாட்டி நொங்காட்டம் இருக்கும். ஓகே, டெண்டர் கோகோனட் ஆர் like a palm fruit. And this is the classic picture with a daughter cyst. And you can see hooklets if you are lucky. And whenever you see some things like this on the HNE, you can go for lower the condenser and you can get a refractile material. So these are the hooklets, and these are all diagnostic of hydatid disease. It can happen in liver, spleen, lung. Those are all the most common. But coming in the bone is a very, very rare disease. Our patient is very lucky to have hydatid disease rather than sarcoma, either chondrosarcoma or osteosarcoma. Case number 2 is a 41-year-old female, mass in the ileocecal region. I'm not a radiologist, that's why I put the arrow there. So this is the mass in the ileocecal region. And this CT, they thought it is malignant, it is pushing into the lumen and it is coming out of the serosa into the adjacent structures. So they thought, can it be adenocarcinoma of the colon or sarcoma of the peritoneal cavity? And they went for right hemicolectomy. And this is the gross picture where you can see a big mass with the areas of hemorrhage. But when you took sections, and this is the mucosal side and this is the serosal side, and you can see the lesion involving the submucosal area coming into the serosal area. And when you see under the microscope, you can see glands and the stroma, which can be highlighted in this picture. And whenever you see epithelial glands with stroma and areas of hemorrhage, you have to think of endometriosis, especially in females. And that patient also had a para-aortic lymph node. Here you can see the lymphoid structure with the primary lymphoid follicle. And that also showed endometrial stroma and the endometrial epithelium. So this is the highest power to show the endometrial gland and the endometrial stroma. And this is from the lymph node. You can see some lymphoid structures. So this is diagnosed as endometriosis of ileocecal valve or ileocecal junction and involving the para-aortic lymph node. And when we told this diagnosis, the clinicians are almost in tears because they thought this is a very well advanced cancer with the lymph node involvement. But the good news and the sweet news for this patient is endometriosis of the ileocecal region and para-aortic lymph node. The patient don't need any other treatment, and they can have a very happy life. Imagine if it turns out to be a carcinoma with the lymph node involvement, they have to go for chemotherapy and radiotherapy. So this patient is very, very lucky to have this diagnosis. Case number 3, 51-year-old female with vaginal bleeding, and ultrasound, transvaginal ultrasound showed endometrial thickening. This is the myometrium. You can see cystic spaces here, and this is the endometrium. It is very much thickened. And because of the perimenopausal age, vaginal bleeding, and thickening of the endometrium, they thought of adenocarcinoma of the endometrium or atypical endometrial hyperplasia. Because of the severe bleeding, the patient was very anemic. It's like a 8 grams percent. So they did some blood transfusion and they removed the uterus. And this is the gross picture of the uterus. You can see the myometrium and you can see the thickened endometrium here. The tan colored one is the endometrium and the more whitish is the myometrium. And surprisingly, if you see the glands, these are the endometrial glands, and you look at these cells. The epithelial cells and endometrial glands are enlarged. Enlarged means they are mega, they are enlarged. And if you go to further high power, these are all the normal cells for comparison. Here in this gland, the 1, 2, 3 cells are involved. Whereas in this gland, more than 20 cells are involved. The cells are enlarged in size with abundant cytoplasm that has some viral inclusions. And the nucleus, this is the nucleus that is also enlarged and it is having viral inclusions, okay, pink viral inclusions. And why I am saying enlarged and mega is the diagnosis. So this is a cytomegalovirus. It's a virus affecting the epithelium or the stromal cells where it causes the enlargement of the cells, cytomegalo, and it's a virus. And this is a immunohistochemistry specific for CMV. We don't have to do this case, but when we told the clinicians that this is cytomegalovirus, they are not believing. They thought it is definitely a malignant one. So they wanted to confirm it. That's why we did IHC, which is not necessary in this case because the HNE features are very, very characteristic. And we gave the diagnosis of CMV endometritis, cytomegalovirus endometritis. Any questions? What's the name of the student representative? I'm not able to get that name. I think there are 2 people, isn't it? One boy and a girl. Any questions?
Anyone of you have questions? No, sir.
There are no questions. I will proceed and we will ask again at the end of the presentation.
Okay.
I think we are half done. And this case, it's a 62-year-old male with obstructive jaundice and CBD mass. This obstructive jaundice is not a good sign. It indicates some obstruction of the biliary system. And because of the age, they thought of malignancy. And the MRI shows thickening of the CBD. And even the pancreas is enlarged and edematous. So they thought it is adenocarcinoma and they did surgery for this patient. And this is the bile duct and it shows a lot of inflammatory cells, lymphocytes and extensive fibrosis. Here again, you can see lymphoid follicles. I hope you all have seen the normal lymph node in anatomy and tuberculous lymph node in pathology. This is how the lymphoid follicles will look. And here also these glands and lymphoid aggregates and lymphoid cells. And when you go to high power, there's a good number of plasma cells. Plasma cells, remember 3 Ps. They are plump cells, peripheral nuclei, and you can see the perinuclear halo, some white space. I hope you all can see the arrowhead. And these are the plasma cells and scattered eosinophils also there. And there is some sort of fibrosis in the background. So this is a chronic inflammatory process with the predominance of plasma cells, scattered eosinophils, lymphocytes, and sclerosis. And when you go to the highest power, this is a venule, and the venule is having some inflammation there, venulitis, okay? So we have 3 findings here. Chronic inflammatory cell infiltrate around the biliary lumen, sclerosing fibrosis, and venulitis, perivenulitis. And when you see these 3 conditions, you have to look for a disease called IgG4 disease, okay? And we did immunohistochemistry for IgG4. All these brown stains are the plasma cells that are positive for IgG4, and it is more than 40%. That's the criteria for diagnosis of this disease known as IgG4 cholangitis. Again, when we gave this diagnosis, the clinicians, they hugged, because the prognosis of pancreatic cancer is 2 to 3 years, whereas this IgG4 disease responds to steroid very well. The patient doesn't need any other treatment other than steroids. And as a student, you should know the IgG4 disease can happen from head to toe, and it has various names. I don't know how many of you know Riddle's thyroiditis in thyroid. It is now IgG4 disease. Wherever you see extensive fibrosis with a lymphoplasmacytic infiltrate and scattered eosinophils and perivenulitis, we have to think of IgG4 disease, which carry a very good diagnosis. And the last case, it's a 42-year-old male. He had a weight loss and 2.5 centimeter pancreatic mass. And again, clinically, it is not a very good history because of the weight loss and pancreatic mass. Here, this is the radiology of the previous case. Sorry for that. And MRI, they thought adenocarcinoma. Okay, so they did biopsy, and in the biopsy, you can see these bland cells that are arranged in nests. And this is the high-power view where the cells are more monomorphic. Monomorphic means they are more uniform with abundant clear to eosinophilic cytoplasm, round to oval nuclei with fine chromatin. And this chromatin is known as salt and pepper chromatin. You know, the pathologists love edible things. If you read Robbins, there will be a lot of comparison with edibles. And this is known as salt and pepper appearance. And this is very characteristic of a neuroendocrine tumor. And when we did the immunohistochemistry for synaptophysin, it is positive. It is a marker for neuroendocrine tumor. So this is a neuroendocrine tumor. But grading of the neuroendocrine tumor divided into grade 1, 2, 3. And we have to count for mitosis and Ki67 index, where we look for mitosis by doing immunohistochemistry for a proliferative marker. And here I am not able to see any mitosis, but Ki67 probably 1 to 2% per 100 cells. See, these are all the cells of the tumor that are negative. Whereas 1, 2, 3, 4, 5, 6, 7, 8. Probably there are 300 cells here, 8 cells, roughly 400 cells, roughly 2%. So this is a grade 1 pancreatic neuroendocrine tumor. Again, this carries a very good diagnosis. When the pancreatic cancer patients die in a couple of months or years, whereas pancreatic neuroendocrine tumor, they live for a long time. And this affected a very famous person, and that person talked about it.
About a year ago, I was diagnosed with cancer. I had a scan at 7:30 in the morning, and it clearly showed a tumor on my pancreas. I didn't even know what a pancreas was. The doctors told me this was almost certainly a type of cancer that is incurable, and that I should expect to live no longer than 3 to 6 months. I lived with that diagnosis all day. Later that evening, I had a biopsy where they stuck an endoscope down my throat, through my stomach and into my intestines, put a needle into my pancreas and got a few cells from the tumor. I was sedated, but my wife, who was there, told me that when they viewed the cells under a microscope, the doctors started crying because it turned out to be a very rare form of pancreatic cancer that is curable with surgery. I had the surgery, and thankfully, I'm fine now.
So these are all the 5 scenarios where they are expecting bloody news, and we gave the sweet news. And that's why I titled this as Pathology, which is bloody sweet. And I think you all know about this tagline. And this is from the famous picture Leo. And I'm very happy to share these 5 cases. Like the 5 patients, I think all of you should be very happy. And please remember, pathology is not always bad. sometimes it can be bloody sweet. So the references, Google images, most of the images, especially radiology, I got it from the Google. And the Steve Jobs 2005 Stanford commencement address, all of you should hear. Please take a snap picture of this, go to YouTube and put this, and I think this runs for 22 minutes. And finally, I thank Lokesh Kanagaraj and Ilayya Talapati Vijay for the title Bloody Sweet. Happy Diwali to all. And I have a request for you. Whenever you take some dresses, at least 5% you go with co-op tax. ஸோ 2000 ரூபாய்க்கு துணி எடுத்தால் ஒரு 100 ரூபாய்க்காவது 2 கைத்தறி துண்டு வாங்குங்க. ஏன்னா we will support the poor weavers. If you don't understand Tamil, let 5% of our dress purchases be from weavers to support them. Whatever we do, we should have some thing given back to the society, and by helping poor people, you are helping the society. And once again, happy International Pathology Day, 8th of November, which is second Wednesday of this year. And thank you very much and have a great time. If you have any questions, I will be more than happy to answer.